Bana Morogo na kutafuta Trans Nzoia County ishazungumza ikiwa kwa upande wa Noreb, kwa hivyo tutawacha hao. Nandi, daktari kutoka Elgeyo Marakwet, tafadhali tuje. West Pokot niliwaona hapa. Baringo, Samburu, ikiwa mlifika tafadhali njooni. Turkana County tulisema tuanza na nyinyi. I do not know who is presenting on behalf of Turkana County. Tafadhali kuja hapa mbele tuweze kwanza. Turkana County, these are the North Rift Economic Block counties. Kindly come to the front. The CECs or the CEOs or whoever it is that is making the presentation. Ekiru Alice, please look for Turkana County. I need the person making the presentation. Naomba tafadhali Turkana County, West Pokot, Elgeyo Marakwet, tafadhali njooni hapa mbele. The CECs. Wale mlio pale kwenye swimming pool area, naomba mje tafadhali. Naomba mje tafadhali. I'm requesting the ushers that are present, kindly assist me to mobilize people. We need to move the program. The chief guest is on his way and we cannot keep him waiting. We will have to drop some presentations if we go at this rate. If present, Elgeyo Marakwet, West Pokot, Baringo, Samburu, and Turkana, our hosts. Tafadhali, tuje kwenye ukumbi, we want to start. And I also want to request the Mount Kenya and Abadeas region block, tafadhali pia nanyi muwe tayari. Meru, Nyandarua, Tharaka Nithi ikiwa tuko hapa, Embu, Murang'a, Laikipia, Nakuru, Kiambu, tafadhali tuwe tayari because we are going to move into that session immediately. And we also have a very important activity that needs to happen, so please don't stay out. Your vote will get lost if we are going to get into that space of voting. Has someone mobilized for me the CECs from their place and the CEOs? Neema, those who are in the Neema restaurant, tafadhali walete wote hapa tuanze. I keep feeling like I'm talking to myself because I can't see the CEOs and the CECs. Wale ambao wanafaa kuwa hapa mbele nimeona Turkana County peke yake ndio wamefika, and we are going to proceed. Please note the chief guest is on his way and we cannot delay the program once he is here. we will move on to the closing session. So let us redeem time. Fadhali, we redeem time. Can the presentation from dia umesimama kwa wave line yangu ninapata waves. Thank you. Thank you for the CCs who are back. I appreciate your presence. Thank you very much. The CEOs who are also present, asanteni kwa kufika. Now, Turkana County, Judy, I'm told you have the presentation. Please bring the laptop here. We start. All right, just a quick roll call. I want to do a quick roll call, a very quick roll call. Do we have the Lake Region Economic Block counties in the hall? Please, ebo inua mkono kama mko watu wa Lake Region Economic Block. Your hand up, Lake Region Economic Block counties. Anybody from Migori? Yes, I see the CCs here. Nyamira? Anybody? Siaya County, mkono juu, tafadhali. Anyone? Whoa. What am I doing? Bomet? Vihiga County, mkono juu. Haya. Bungoma. I want to do something that is called taking a vote, and I'm not sure whether I'll do that. Kakamega, you made a presentation and disappeared on us. Kisii, Kisumu. All right, so I want to request us to take our seats. We already have the county from this region, that is Turkana County, ready to present. I see that now I have other counties. So we have said, post this presentation from Turkana County, we will have the Mount Kenya region, the Mount Kenya and Abadeas region economic block coming up. So I requested, and I'm requesting again, if you are from Noreb, tafadhali, this is a final call for those from Noreb. Tafadhali, Nandi, if you are here, Elgeyo Marakwet, West Pokot, Baringo, tafadhali if the CC is around akuje. Kama hakuna, tutaendelea na huyu mmoja aliye hapa wa Turkana. But before that, I want to invite Dr. Moma to take us through a very short session, very quickly. Dr. Moma.
Thank you so much. The session I just want to take you through is the one that allows us finalize our communique, which we have been working on and which we are going to present shortly to the governor before he comes here. And the last clause in our communique is the next conference where we are going to hold it. And what we have done in the past, and I want the ushers, 2 to be in front here, 2 to be at the middle. So we normally ask which county is ready to host us in the next conference. We have been in the Lake region, so we are not going there. We are in Norep, so we are not going to take account from Norep. We have been in Mombasa, so we are not taking account from Mombasa. We have been in Nairobi, so Ruth, we are not taking Nairobi again. We have not been in the eastern part, in the Mount Kenya region, and also in the FCDC. So I want proposals from those counties to volunteer to host the next conference, and if we have only one, then we will go there. If we have 2, 3, then we will vote. So by show of hands, who are ready to host us? Okay, let me start here. Somebody to write the counties, please. Yes? Garissa County has been proposed. Please write for me, Garissa County. Somebody. Immaculate? Please write. Then, there is Meru has been proposed as second county. Thank you. Embu has been proposed as the third county. You know, I want people from that county to propose. That's the other that I propose. You know, when you propose, and do you come from Embu? Do you come from Meru? You proposed Meru, I don't know. Are you from Meru? Very good. You are from Garissa? Yes, we want the honors to propose. So we have Garissa, Meru, and Embu who have proposed. Yes, at the back, shout. Are you from Machakos yourself? Very good. Machakos number 4. Another? I think that's enough. 4 is enough. So we are going to vote. Please, ushers, are you standing somewhere where you will count people? Yeah, so we have somebody here who will count those from here up to, where is the other usher there? Yes, kufika pale. This one will count from here up to there. Na wewe kutoka hapa mpaka pale. And then wewe utacount wale wako huko nyuma. Sawa sawa. So the first proposal was Garissa. Can we see those who are supporting that we go to Garissa? Please, you put your hands up, and then you wait until you are counted until I'm given the number. Garissa. Shh. That is rigging. Please don't talk. I just want a hand. We want to finish. No, please. Garissa, please count. I'm waiting for the totals. Okay. How many? Can you meet the secretary? Those who are counting, can you meet and give me the final number? Okay. Dog. Okay, unaona mikono haichoki. Okay, how many do we have? Put your numbers together. Okay, put your hands down now. Thank you. The second one was kutana haraka muweke hiyo numbers down. Then wengine msimame mutacount. Meru. Oh, sorry. Wait. I'm waiting. Online people, can you the team online also count how many are for Garissa? And I was from online. Okay, as they give us the numbers from online, how many proposed Garissa? Now Meru County. Okay, Meru County, I can count 1, 2, 3. Very good. Meru County, as we wait for the number for Garissa. Then there was Embu. Embu, please. One hand. Where? Embu, I can also help to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 Embu. So, you are Embu. Embu 14, 15, 16, 17, 18. Very good. So, the counties that, have I left any count that was proposed? Machakos, maybe that is the one we want to go. Very good. 1, 2, 3, 4, 5, 6. 7, 8, 9, 10, 11, 12, 13, 14, 15. Thank you. So, 15. So, wait. We are in the process. 15, 16. Very good. So now, we have 3 counties. We have Machakos 15. We have Embu 17. We have Garissa wameshindu kuhesabu.
And then 5 Garissa. Online 5. 5.
Okay, online we have 5 for Garissa and Meru 5 and Meru 5. We don't want to leave anybody out. So Meru 5 online plus 3, that is 8. We have Garissa, we have Embu County 18. We have Machakos County 16. We have Garissa County 5 online. 5 online plus 70. So the next hosting county is Garissa County. Give them a round of applause. So now work begins. What Turkana has done was to organize this thing and convince their governor to ensure that it's there and convince other governors. Sasa kazi kwako. Thank you so much. That's what I wanted us to do so that we can finalize the communique.
Asante sana, makofi kwa Garissa. Meambiwa kazi kwenu, bora si kwamba mtafanya tu kazi, lazima iwe kazi ya kushinda kiwango hiki, sawa? Haya, we now get into the next session, please. Let's give attention to Turkana County. The presentation is here. The presenter has been around. Please come and make your presentation. Max 5 minutes tafadhali, and then we will kwa anasema ana check. Sawa.
Okay, thank you. I am Akiru Alice. I am the administrator in charge of ECD in Turkana County. I am standing in for my chief officer. Turkana County Directorate of ECD has 5 main sub-programs. The first one is ECD Quality Assurance, and in this sub-program, we majorly focus on ensuring that we provide quality education to our learners. And from this sub-program, we are proud to say that we are the pioneer county, that our ECD teachers were among the first ones to be remunerated using the SRC circular, whereby our certificate, ECD teachers with certificate, they are employed with job group G. Those with diploma, they join with job group H and J, and those with degree, they are employed with job group K. We have 21 ECD ward education officers, 6 sub-county education officers, who are by large our M&E officers at the ward level. We have 10 motorbikes and 2 vehicles for quality assurance, supervision, monitoring of our ECD programs at the school levels. In addition, we have 3 trucks, lorries, which we use to facilitate ECD feeding program. We have our customized Turkana ECD policy that is still at the cabinet level, and our teacher trainings are majorly supported by partners and the county government, and some of these partners are UNICEF, LWF, that is Lutheran World Federation, Fin Church Aid, and World Vision Kenya. Lastly, on the quality assurance bit, our ECD centers are programmed with very strong synergies at ECD levels, whereby we reach out to the community so easily through our village administrators, and some of them are in this crowd, and our ECD ward education officers and BOMs for each ECDE. The second sub-program is ECD feeding program, whereby we provide free food to all public ECDs in the county. By extension, in the feeding program, we have partners like Mary's Meal, Feed the Children, AIC Health Ministries, that are also supporting us in the ECD feeding program, and JICA comes in a special way to ensure that all our kids getting either rice and beans or maize and beans have additional nutrients through vitamins. We have, in the documentary we watched on the first day, we have something called ECD Veggie Lunch, whereby the kids plant the vegetables at the schools and they get it from there to add to their meals. We have Turkana Disese College, whereby our teachers are majorly trained there on in-service and other refresher courses. We have a very strong multisectoral forum for coordination of all ECD actors in the county. We have over 30 ECD partners. On statistics, we have a total of 1,026 public ECD centers and about 70 private. Of these, we have 19 ECD centers in the refugee and Kalobeye settlements. Our total enrollment is 138,297, whereby for PP1 and PP2, we have PP1, 62,361 and 43,492. And we have a special category of 0 to 3 years, which come to our centers majorly for feeding, care, and protection. We have 2 ECD social welfare officers, both are females, 1 director, sub-county education officer, 6 of them, and ward coordinators. We have 283 male teachers and 262 female teachers, and a good number of them are on PNP. Turkana County, in partnership with most of our partners like UNICEF, we provide trainings like Nurturing Care Framework, CBC for our teachers and DSS trainers. We have done a training called Mental Health and Psychosocial Support for our ECD centers, for our ECD teachers in both the host and refugee communities. We have done a training on KISRAT, Kenya School Readiness Assessment Tool, which was supported by UNICEF, and we have done too many BOM and parental association trainings to sensitize our BOMs and parent communities on their roles in managing and ownership of ECD programs. We have, in support of World Food Program, we have done ECD feeding guideline, which is our policy document that guides on how to do the rationing and procurement of ECDs, including cooking and all that pertains ECD feeding. As I said, on the Veggie Lunch, we have community sensitization on food sustainability, whereby we directly engage our teachers, parents, and BOM communities to take part in this program at the ECD center levels. As I mentioned on ECD partners, we have over 30 of them, but I can only mention a few, like UNICEF, JICA, World Food Program, Lutheran World Federation, Fin Church Aid, Save the Children, AIC Health Ministries, WHH, Wealth Health Elter Hunger, it is I think a German name, Feed the Children, Build Africa, among others. We have a few challenges. One of them being inadequate budgetary allocation for quality assurance. Of course, you know quality assurance is a big program, and in this we also have intervention of our partners, but it's still a challenge. Our county is so vast. We are 77,000 kilometers square, and by this it causes a challenge on mobility, given that we need to do good quality assurance and supervision of our programs. So the county is big, we have a few motorbikes and vehicles, and that is still a challenge. Our teachers to learner ratio is still low, and we are privy to that, and I think the government is working on that. Those of you who can see the screens, we have a few photos that gives you a general overview of our ECD setup in Turkana. The county, we have a model construction for our ECD teacher centers constructed by the county government with a dining hall, class, fence, toilet, and water tanks. We also have a special category of mobile ECD centers. We are a pastoral community, and we provide, the county government provides trained teachers and instruction materials and feeding program to these centers in the communities that are moving, the pastoral communities. The second photo shows that. We have one ECD center called Pole Pole Olabide in Turkana North, Lokitang. This is our model ECD with all pertaining nurturing care framework in one compound. We have a special side for a hospital, cooking area, caregivers, and all of them are all trained on matters nurturing care framework. The other photo, the third photo on the upper side is on a locally constructed ECD centers. They also have their vigilance programs and everything, in as much as they don't have permanent structures. And our feeding program, you can see the plates with githeri and veggies. There is a photo there with seeds that shows the sustainability model of our programs like the Veggie Lunch, whereby we ensure that we train the teachers and communities on how to take care of the vegetables, harvest seed, and preserve these seeds. And one of our ICDs called Nadapal, we have more than 30 households that come to the school for the seeds, and they go to cultivate vegetables using the seeds that are produced from the school. On a special notice, through the session chair, we have a digital M&E system. We started it with TechDem. It is the umbrella name is TechDem, is Turkana ECD Management Information System. And through this, we have Codices, which we have implemented through our partner called JICA. Codices in full is continuous database updating system. By this, I will scroll through fast because of time. By this, it is a system that we go to collect real-time data from the centers, and we have developed a small data collection tool called via Kobo Collect. Most of you are familiar with Kobo Collect. We train our ECD ward coordinators, who are our primary M&E officers at the centers, and our ECD sub-county officers. They go to the center with the Kobo Collect. They collect data, everything pertaining enrollment, infrastructure, feeding program, instruction materials that are available in the school, and if there are any partners that are implementing their programs in the centers. And this includes also the health records for deworming, growth and development for the kids. They do the real-time data collection. We have a GPS that if you are from the office, I can always see this and this officer is at this center and they have collected this data. And the moment they collect the data, it updates automatically from our system, and someone at the server will always know this data, the enrollment for this term was this, and for today it is at this, and we can always track the progress. So through Codices, we have also created our monthly reports. We have a digital platform whereby our sub-county education officers, starting this month, will be doing their monthly reports using the Kobo Collect, and I from the office will always be doing it online. Through this, the Kobo Collect tool, it has reduced the it has helped in cost effectiveness of data collection, because it is cheap, it doesn't require a lot of bundles, and the data is always transmitted automatically. So it reduces the weight of getting the data, actual data. Sometimes you realize back then you could not trust much on the paperwork. So it has also reduced on the paperwork, manpower, because our coordinators go to the field and we get it from this end. So we don't need regular meetings on sensitizing people about always the data, because they are all trained, and from that point, when we get new coordinators, the ones we have trained today will always train the rest that are coming. So it is a very sustainable way, and we are working it as a partner with JICA as a partner and the county ICT office. So this thing belongs to the county in support of the partnership. So you realize the sustainability bit of it has been considered. With that, thank you.
Thank you very much. Makofi makubwa kwa Alice na timu yake. A lot that you can still follow up with them on. Sorry that I seem to have been standing all over her. But the slides will also be shared with you. I've just had a chat with the chief who tells me this is the best system. It has improved the way they are managing education in this space. I know that we also have other sectors, and I hope that at one point in time, we will also get data around that for Turkana. So we are going to invite Elgeyo Marakwet to come and make the very brief presentation. Meanwhile, could I request the Mount Kenya and Aberdare region CCs to come very quickly, and Nairobi, kuja tafadhali tuweze kupata muda wetu kwa haraka, tukamilishe. So those from Mount Kenya and Aberdares, Mkuba karibu. Introduce yourself kindly and then let us have this session run.
Thank you very much. Moketu Julius is my name, Chief Officer of Spokot County. And I want to thank all the organizers who have had very good experience. And I want to say Turkana County, God bless you. Otherwise, before me, I want to introduce our presenter from West Pokot County. We are working as a team to introduce ourselves and then now take us through. Welcome.
Okay, shalom to you all. Okay, I'm privileged to be in Turkana County. This is a paradise place. You have come from very far, this county. My name is Helen Kamama, Assistant ECD Deputy Director. Okay, West Pokot comprises of 7 sub-counties. And also we have 20 wards. We have also employed the ward coordinators who are under P&P. Our governor is so passionate about the ECD. We have 1,177 public ECD centers. We have 79 private centers. We have 1,646 ECD teachers. And soon, the governor is going to confirm them. They are engaged under contract. In our county, we are also issue the saucepans, or rather the sufrias, to accompany the porridge. The day we commenced this conference, they were busy issuing 45 porridge. We have also scaled up the child-friendly environment. We have constructed ECD classroom since the devolution. We've also budgeted for water tanks. We've also equipped ECD centers. We have purchased tables, chairs. We have also purchased instructional materials and i.e. the course books designs, which are in line with the CBC. The county government is also training ECD teachers on CBC. Recently, last month, we trained 6 wards in North Pokot sub-county, that is Alale ward, Kasei ward, Kapche ward, Kiwawa ward, Kodich ward, Swam ward. We've also Sisters of Charity, who are frequently training of ECD teachers in Sok ward and Endu ward. We have also World Vision, who have also helped us in training funding the ECD, the World Vision in Seker ward. The county government also have deployed ECD teachers to those vulnerable institutions, as we mentioned, the prison, to help them in teaching the learners. Pertaining the inclusivity, the county also have deployed teachers to St. Francis School for the Visually Impaired. We have also Keringet School for the Deaf. We have also purchased play materials, the skipping ropes and many other things. This one thrills the learner, and it makes also the learner runs to school. It is also going to promote the talents. As we know, we are in the era of CBC, so that is where we can identify the talents for the learners. The government also have purchased land for the ECD, for example, it promotes play. We need to have a playground. We have those plans also. Some are underway. We have 146 health facilities. We have the outreaches to reach these areas by partners, i.e. the Red Cross and Rotary doctors. Pertaining the skill deliveries, we have at 65% as per the KDAS 2022. Family planning, we stand at 23%. This is very low because we have also cultural practices which are very retrogressive. We have also the myths. So the myths, they normally say that we reduce the number of children. They don't want that. They want the mother at least to have over 10 children in a household. We have also the gender-based violence. The men, they don't even agree their wives, or rather the better halves, to go for this, the family planning. The 4th A ANC clinic visits stand at 34%. The teenage pregnancy stands at 36% because of low education. We have also poverty. We have lack of capacity building. The cancer screening in field facilities. So we need training of health workers to capacity build them. We have also the school program, health programs, whereby the health officers, they visit those schools, they deworm the learners by giving them the dewormers, vitamin supplement, and many others. So on the policy, we have a policy which is at the county assembly stage. With those few remarks, I'm very grateful. Thank you.
Haya makofi hayatoshi. Hebu mpigieni makofi kabisa. She has given us a very comprehensive picture of what is there in the county, and somebody must have heard that teenage pregnancy stands at what? 36%, which means that there is need for us to make sure we intervene in that particular space. Asante sana, because you've also helped us to just see how it is that it is one county that we can still get 10 children. Ndio. Ninataka tuende sasa to the next block, and this is the Mount Kenya Aberdare region, and we are going to begin with Meru. Yes. Tunataka tuanze na Meru, kisha tutaendelea na wengine. We all are aware that we have a very strong team here. Kindly.
Good afternoon, everyone. I'm Dr. Kidura Yusuf Rutere, another alumni of Kenyatta University. I can see my colleagues are here. And I'm here to represent the county government of Meru, the CEC education. Contrary to what you have just heard, Meru is absolutely different, with a lot of food, a lot of resources, and this morning I consumed something from Meru. It is the only county with the strongest woman. Wanawake muko wapi? Muko ama muko? This is a county with the strongest lady, Bishop Kawira Mwangasa, the one who has jumped too many handles that nobody here can jump. And is the county that is moving with the highest speed of 400 kilometers per hour. And I know you are feared to go to visit Meru because of the speed.
But it is my prayer, after Garissa, you come to Meru.
Meru has about 776 ECD centers with enrollment of 59,682 children. This accounts for about 98%
enrollment. We have about 1,715 ECD teachers who are fully trained and employed on permanent basis. We are partially borrowed from the County of Governors
scheme of service, and we are almost there. It's only that we have not fully recognized those who have undergone higher education, like in diploma and degrees. We have a huge budget for ECD program, which is about 500 million Kenya shilling annually. This one goes to development, mainly on infrastructure, and our ECD classrooms, most of them, over 85% are permanent classrooms, meaning stone, not timber. We are also CBC compliance, and we have on budget every financial year to train our ECD teachers on CBC. So all our teachers in ECD are CBC compliance. And every year, we have a budget for new recruitment and employment of teachers. For example, this year, we are employing 125 teachers to ensure that all our running centers are properly catered for. In the region, we also have 3 prisons, the main one being Meru prisons. And the ECD classes are there, centers are there, but unfortunately, they are not fully developed, and we have run a lesson that we are going to implement immediately when we get there. The challenges we have are not as many as many other counties, but Kenya being a developing country, I don't think whether there is anybody who has or there is any county with enough financing. So financing is a common problem to every developing country, Kenya being one of them, and Meru County being among the counties in Meru. So just like other counties, we have financial constraints, but not too much, because every year we have a budget for that, and that is where we take our money first, because we really value the life of these young children. There is also a problem of learning materials, but we are lucky, because much of what you are using are sourced from the locality. So every region we use what is locally available, and we supplement that with retail purchases. Teenage pregnancy is very low, but unfortunately the population growth rate is going down. Annual enrollment is going down, except for other few counties where the population is growing. Reasons, the researchers are here. That's an area of research that you can come and carry out your research in Meru to find out why the enrollment in CNBC, ECD is going down. And this is related to reduced birth rate. There is also understaffing, simply because of financial constraints. Otherwise, because of time, there is a lot you can learn from Meru, and it is my humble request that you come that time, that is next time after Garissa, to enjoy the good climate, and that is where people feed and they feed properly and they become big as I am. Thank you.
Daktari, asante sana. I think just because of that, let's remember that he has requested us after Garissa, tuende kwa baridi kidogo. Sindio? Asante. Daktari, once you're done, I think it's okay for you to just take your seat on the other side. So, right, Nyandarua County, very quickly to the two of them. One can come and introduce himself and then allow for the other to make the presentation, and then we continue.
Good morning, participants. Good afternoon. I'm John Moiro, Nyandarua County, CCM Education, and my director will do the presentation. As a central block, I've seen our CEO did not attend, so I don't know whether we have one. If we don't, we can bestow director to take over the CEO position.
Thank you very much. That's our CEC. We also have in our midst our Chief Officer, Dr. Pacomius Wambugo. We also have our CEC, CEC Health and our CEO Health. It was a big team, but the whole team was actually headed by our First Lady. So we are a big team and we are happy to be here. So ladies and gentlemen, this is Nyandarua County. And it is in the Aberdare region, or what we're calling Mount Kenya Aberdare block. And the major economic activities, of course, is farming, quarrying, and also trade. And agriculture is actually the backbone of our economy due to the fertile soils and the favorable climate. It is considered the food basket of Kenya. This one is known because of the high production of potatoes, cabbages, carrots, peas, milk, that are sold in Nairobi and other areas of the country. The county experiences high temperatures. We have averaging at 21.5 degrees in December. That is our highest temperature. And we have an average of 7.1 degrees in July. So when we talk about hardship, when we talk about high temperatures around here, then we are talking about low temperatures in Nyandarua. So when we define hardship areas, we need to redefine that. We have 25 wards and 5 sub-counties. In terms of population, we have about 638,269 as a population. And out of this, 0 to 4 years, we have 69,988, which is about 10.97%. And between 4 and 9 years, we have 74,903, and that gives us 11.74%. And this means that we have a critical age of below the age of 9, which is at 22.74%. And that means this is a critical population that does not need to be ignored. In terms of the centers that we have 501 public centers, and our enrollment stands at about 24,000. Now, in terms of our different aspects of ECD, because of time, I'll share this, but the ECD classrooms, the feeding program, the ECD furniture, teaching and running materials, when you look at the budget allocations along the way, you realize that they are very low, and they are also diminishing with the time. And this one is against the background of what we have given a lot of emphasis, and I know this is something that is a challenge to all counties, the issue of the bursary. So that you see other components are going down, but the bursary allocation is actually rising. So some of the initiatives that we have in terms of the welfare of the children, the last financial year, because of the new government, and we are very happy with our current governor, because for the first time we have the word children in our department. Our department is called Education, Children, Gender Affairs, Culture, and Social Services. So we have a platform now for children, and we have started some initiatives. For example, last financial year, we were able to do, through collaboration with AIC Cure International Hospital based in Kijabi, a county-wide assessment of children living with disability. And out of this, 18 children benefited with corrective surgery in that last financial year, and this is a very good start for children with some disabilities. We also supported 100 children to participate in the African Child, the Day of the African Child, and you know that is a forum that we are supposed to participate as children. In talent development, the county is progressively supporting drama and music at county, regional, and the national level. So we have also gone ahead to provide appropriate furniture, teaching and learning and resting materials, but it is progressive. It is this work in progress. In some centers, around 160, we have been able actually to offer some blankets and mattresses so that we can give an environment where children can also be able to rest. That is beside the issues of the curriculum designs, the issues of chairs and tables. Of course, we have been able to support that. And we have also supported teachers in terms of training, and also providing play equipment, that is internal indoor play equipment. And this one was a big move to us. We provided what we call building blocks, and you saw a very big change in terms of cognitive. It became it is a mind engaging activity. So we are promoting activity. In terms of nutrition, we have a school feeding program in progress, and ours has been the school milk program. And out of this, we have seen an increase in enrollment. Actually, with a time we calculated to 3% enrollment increase because of that. The motivation of pupils and also teachers, it reduced absenteeism and active class participation because of that program. The number of ECD teachers that we have been able to employ, the county has employed 381 teachers on PNP and 200 teachers on contract, but we are happy to note that our teachers employed on PNP are actually earning according to their achievement, according to our own scheme of service, which is actually very progressive because it encompasses even the other personnel in the ECD sector. The impact of this was huge. it was enormous when we introduced that. Now we have also a table here that will be shared, where we have identified the different components of our education, where we are, and the gaps that we have. Because of time, I'll not be able to share that because it's about activities. But we have also identified our gaps, like the issues of screening tools for disabilities. We don't have one. We require at least 5 sets. You know, recreational sporting facilities and so on, we don't have that. But the issue of capitation, we have, now this financial year, we have allocated 400 shillings per child. It is quite low, but it is a good start because now we have a line which we can be able to improve. We want to improve it to at least 1,000 per child. The challenges that we are facing are just like any other county. One is that we don't have a system for real-time data collection and management in public and private ECD centers. And I know even ECD centers is not a challenge to us only, even other counties. But I think this is a gap that we can, the actors, the development partners can come in and help us. We also have lack of quality assurance standard services personnel. Of course, the infrastructure is not adequate. And of course, the funding that we have been talked about. And also, we are noting one important one, and this is a gap that where partners can also come in, personnel, in terms of capacity to handle children with special needs. So we have identified our priority areas in terms of infrastructure, full implementation of the schemes of service, capacity building on CBC and KISLAT, setting up SESEC, and ECD boards of management. This one we shied off a bit because of 2 centers of power, but now with the capitation, we have to come up with it. Then enhancing the feeding program and the harmonization of the ECD Act, we have been able to do that. In terms of health, allow me just to mention this because we are collaborating with the health department. For example, we have been able to identify that the percentage of deliveries conducted by skilled birth attendants, we are at 65.1, so you can see the gap. Percentage of pregnant women attending at least 4 ANC visits, 57%. Proportion of pregnant women who attended at least 1 antenatal clinic during pregnancy, we are at 84%. The infants who are less than 6 months, exclusive breastfeeding, that for female, we're at 84. So we are doing well there. For male, it is 85.8. I don't know why the difference. Then proportion of children aged 12 to 59 months who are supplemented with vitamin A, we are at 100%. We are doing well there. Then proportion of children under 1 year, who are fully immunized, we are at 88.3%. And proportion of school age who are dewormed, we have 25.5%. Our takeaway home, please, we have decided to take 3 points. That we do a deliberate effort to create a multi-sectoral working group on matters ECD, and we are hoping that Her Excellency, the First Lady, will take the lead. Then a deliberate effort to assess the status of our child care facilities in view of having structured capacity building and registration of the same through public-private partnership initiative, and also introducing a digital learning program, and we have already picked IDU for engagement. Thank you so much because of time.
Asante sana, apigiwe makofi. The First Lady was here, therefore we have heard she's going to be a champion. We trust that Madam First Lady will follow up with her to find out whether she's spearheading the establishment of the multi-sectoral team. Thank you very much, Ndaro. We want to invite Embu very quickly. For want of time, please just make sure we keep it short and so that we can focus on the next.
Thank you very much, Mr. Chairman. All protocols observed, ladies and gentlemen, good afternoon. I am Daniel Granwa, CCM, Embu County, the land of opportunities. We are here as a team. I have my chief officer. You can say hi. Uko, wave to the crowd. And I have my director here who will present what we have in the ECD. Ladies and gentlemen, I would wish to remind the chairman that Embu has always been the center of Eastern. Kenya was known in terms of provinces, we were the headquarters of Eastern Province. So, and here, of course, you saw we had quite a number of folks. Why don't you come to Embu? Instead of even going to Meru, next to Meru. So I welcome the director to present. So you're welcome. Thank you.
Thank you. Keep it brief, sir.
Thank you, Waziri. My name is Jeremiah Reni, and a student of Kenyatta University, I must say. Now, so in Embu County, I'll just look at the figures. Maybe I'll just deal with a few issues that maybe that were not mentioned by other counties. The figures are in the tables that we have. We have health facilities and number of community health workers. So far, the county has not employed the community health workers, but they are working with the Department of Health. In terms of programs under health, we have the immunization, the vitamin A supplementation. We have issues of HIV-exposed infants follow-up and provision of care and treatment for the positives. And then, of course, growth monitoring that is done by Department of Health as part of the multi-sectoral activities. Then in terms of budgets, I think we have, under health, we have budgets for deworming and Marezi Mbora. And also under Department of Gender and Children Services, we have a rescue center that is in operation that has been funded by the county government. In terms of the challenges, I think it's just funding in terms of erratic supply of health products at the health department and human resource. In ECD, Embu County was among the first counties to employ all ECD teachers as per the scheme in 2004. So our teachers are on P&P at the levels of diploma, certificate, and the ECD officers at degree level. Our ECD centers are 398. In terms of funding proportion, in terms of the Department of Health, we do like 86% of the funds in the Department of Education. In terms of salaries, that is around 245 million. In operations, we also have a big chunk, and we also, in the department, we need in terms of infrastructure. Now, in terms of the programs, I think I'll just mention that, of course, that are not here. I've been mentioned before. We have two things that maybe we are doing that I have not heard from other counties. One of them is on co-curricular activities. Our children are involved in co-curriculum activities. We are the reigning champions of singing games in the nationals for the last 2 years in the national level. Our children were able to entertain at Kisumu last year when we won the nationals. We are now defending that title next week, I think, in Nyeri. We also position 2 in drama festivals for the ECD children with choreographers. I think number 1 was Nairobi, so we are following them. So on extracurriculum activities, we are doing well for the children. They are participating up to the national levels, and we have been winning trophies. The other thing that we are doing as a county that probably I have not heard mentioned is on the digital learning program. In the county, we are implementing a digital learning program under EDU, and I think they are here. So all our ECD centers have digital smart devices that are being used by the teachers in terms of curriculum development. So, which is a technology or a program that runs on smart devices to enhance education outcomes in classes. So in all our public ECD centers, our centers are equipped with digital CBC curriculum activities for mathematics and language and EDU. And this September, we are rolling out the Tayari program, still under the same program, to ensure that our ECD centers are supported in terms of digital learning. Then we also have a program we are doing with the University of Embu. We won a grant from Spencer Foundation that we are using on a program of upscaling, optimizing parental empowerment and engagement in preschools. So we got a grant from Spencer Foundation US of $50,000. This program we are doing, it's to enable us to have a prototype parental empowerment and engagement training program that can be upscaled in the entire country. So far we have done training modules that we have validated with the university. Then we are in the process of treatment of the teachers and the parents. And we hope by the time we'll be having the next conference, then we'll be able to give our results in terms of what you found in terms of parental engagement and empowerment of ECD children at that level. We also have an NGO that we're working with on child-based right approaches. Issues of challenges that we have in the county. On policy, we have a number of policy documents. We have done an Early Childhood Education Act. We also have a Child Care Facilities Act. Then we're also in the process of doing a school feeding program fund that will be used in terms of funding for the pre-feeding program. In terms of challenges, I think they're just like other counties, understaffing, issues to do with the lack of curricular support materials, and capitation grant for schools.
way forward, one of them is, of course, a capitation fund for children at this level, because I think this is the only level that does not have. Then we also want to ensure that we upscale our digital learning program so that we can ensure that our children are fully involved in that program. Then issues of model centers, we are upscaling what we have. Then on parental empowerment and engagement, that's something that you've taken so that we ensure that the parents know exactly what it is that they can have to support the ECD CBC program that you have. So those would be some of the highlights that we'll have, maybe, but because of time, I think I'll get to that point. Thank you.
Thank you. Asante sana, tumpigie makofi. They have policies in place that I have not heard mentioned by many others, especially the Act, and that's a big thing because we now need to move from those and actually implement, and we thank you. The results you say you will share, we will follow you up on, and we are going to check that. So Nairobi County, as you come, I want to just say that we have amongst us guests that have continued to arrive. We are about to get to that place of closing this session. I want to request that water be provided for the people in the tent, please, so that we can have them continue to dehydrate, or is it rehydrate? What is it that you're supposed to do? To dehydrate or to hydrate? Hydrate. These Nairobi guys are making me feel too short. Please, so we have guests. The Deputy Governor is present. We appreciate you. We have the First Ladies from West Pokot and also the First Lady of Turkana County. We also have MCAs in large number here from within this county, and we're expecting more chief officers who are here, the CCs who are part of this crowd here. We are going to introduce all of you at some point in time. So Nairobi County, please don't look like you're going to spend 50 minutes. Just talk now.
Thank you so much, Your Excellency, the Deputy Governor, Your Excellencies, First Ladies, all protocols observed. My name is Ahmed Abdi, the Chief Officer for Education, Nairobi City County. I'm accompanied by colleagues. Director Ruth will going to do the presentation for us. On my right is Rogers. On my left is Mr. Raphael. So, Karibu, Director.
Thank you, Chief. I'll try and be very fast. So Nairobi County on programs and projects. In ECD, I'll only do ECD because we did not get the data from our health colleagues. So in ECD, we have programs on construction of ECDs. We also have, apart from construction of new ECD centers, we have programs, projects on constructions of additional classrooms in the existing ECD centers. We also provide school meals to the ECD centers, as well as milk. We provide ICD linkages to our ECD centers. We have quality assurance and standards programs, as well as carrying out in-service training to our over 1,000 teachers. We have a program on capitation. We have a free ECD program where we have a tuition account in each school, as well as a general purpose account. We have programs on trainings, and as well as participation in co-curricula. We have legislation on childcare facilities, and we also have capacity building regular for our ECD teachers, as well as our BOMs. For us, Nairobi County, we have BOMs, both for ECD centers that are not attached to primary schools and those ECD centers that are attached to primary schools. We have boards of management. We have a lot of legislation that I'll discuss as we go forward. We have a multi-sectoral committee that helps us run our ECDs. On some of the achievements, I talked about our free ECD. We have disbursed 100 million towards the free ECD at a capitation rate of 3,200 per child to over 30,456 learners. For the learners with special needs, for the sake of inclusivity, we give them a capitation of 3,300. Most of these Most of this money goes towards school feeding as well as instructional material, teaching learning material, and other such vote heads that we have. On some other achievements, I talked about construction of ECDs. So far, by the end of this financial year, hear me? The back? Okay, on construction of ECD centers, we finished about 1, 2, 3, 4, 5 of them so far. And on issues of school land, you know, Nairobi, we have issues with problems with grabbing of school land. So we are already securing all our schools, be they primary schools or nursery schools, with title deeds, because for the 7 former municipalities, you know that the land belongs to the county government. So far, we've already issued title deeds to 41 of our schools, and we are doing this on a rolling basis. ECD data. Nairobi is one of those unique places which we have 3 types of schools. So for the ECD centers that are public, we have about, we have